And feeling this kind of these tingles throughout my body, and then sometimes it's a bit numb. It's weird. On my back, my arms, my face, my neck.
Okay. And when did these sensations begin?
It's hard to say. I guess it started when I've been putting my creams on at night, and I think they came about after that. And I don't know, I just don't know what's going on.
Well, that's very good that you came to see me today. I'll be more than happy to give you a very thorough physical examination and assess the state of your cranial nerves, and just do a full body examination. Okay, and get down to the bottom of these sensations.
Good to know.
Have you started any new activities recently?
I started, since it's the holiday season, I started going ice skating.
That's fun.
It is. It's been nice. There was this time that I did fall on the ice.
Okay.
And I got all this ice on me, and it was really cold, and I didn't know what was going on, and it was this weird feeling throughout my body, and
And when did this happen?
it was about 2 weeks ago.
2 weeks ago.
Yeah.
So you fell on the ice, and then you got splashed with the snow.
Yes.
So you have definitely seen a correlation, right? Sensations started after the fall, or did they begin before?
I think it started after the fall. And I tried to soothe it with these creams to help with the feeling, but that didn't help.
Interesting. Okay. Are you on any new medication, Alessandra?
No, I'm not.
No new medication. Are you allergic to anything?
Actually, now that you mention it, I am allergic to coconut.
Coconut, okay.
And I think in that cream there could have been coconut in it.
Oh.
So I'm not sure if that could be what's going on.
That could be. A lot of people are allergic to coconut. It's an allergen for sure for some of us, myself included. So after you've applied the cream that contained coconut, did you notice any changes in your skin color, any discoloration or redness?
Yes, it started getting red on my face, and I can, and then I noticed it went down a little to my neck a little bit, and maybe my shoulders a little, just more towards the upper part of my body, just overall more redness.
All right, so I think I am getting closer to a diagnosis in my mind, but we'll go ahead and begin the assessment, and we'll get down to the bottom of what's been bothering you for sure.
Great, good to know.
So I'm just going to set this right here and sanitize my hands. And given that you did fall on the ice, I do want to make sure that everything is healthy from a neurological point of view. And I'll start by doing a mental acuity test. I'm going to give you 4 words, and I want you to remember them.
Okay.
The words are ASMR, relax, tingles, today. And I'm also going to give you a riddle, and I want you to try to give me the answer to the riddle, and afterwards I want you to repeat the words that I just gave them to you. Repeat them back to me.
Okay.
Alright, so the riddle goes like this. I am as light as a feather, yet the strongest person cannot hold me for more than 1 minute. What am I? I'll give about 30 seconds.
Okay.
so light as a feather, and not even the strongest person can hold me for more than a minute. Your breath.
Oh my god. Wow.
Very good. You're smart.
It took me a second.
Good. So mental acuity, that's check. And now if you could please repeat back to me the words that I gave you at the beginning.
ASMR. Tingles. Relax. Today.
Perfect. So you passed that. All right, let's go ahead and begin the physical examination. And I'm just going to take a look at you. And the assessment is going to involve me kind of touching your skin and making sure that I do a neurological assessment. Is that okay with you?
Yes.
All right. So you can just close your eyes and relax. I'd just like to take a look first and just see if I observe anything kind of just out of the ordinary that, you know, might have triggered the sensations, could be the cause of what's going on. You want to check your body temperature, normal body temperature, no excess sweating on the face. I'm going to palpate your lymph nodes. Okay, lymph nodes are not enlarged. Any tenderness upon the touch? Okay. No excess swelling on the arms. Normal temperature. No excess sweating on the legs. Normal body temperature. Getting a little bit colder towards your knees, but that's normal. And even temperature or all throughout. Let's go to look at your skin a little bit more in depth. See if I can spot anything that's just out of the ordinary. No redness, no swelling. No micro lesions. No blues or gray colors. No tender areas. Not spotting anything abnormal. No lesions, no scars. I'm going to check your arms next. And on the inside. No lesions, no discoloration. Place this one down. Maybe have the other one. Okay, so I'm not noting anything abnormal. On the inside. Okay, most excellent. Alright, I'm just going to note down these observations. Normal skin color, no tenderness, and no abnormal discoloration. Alright, most excellent. Alright, next up, I'd like to make sure that I have your height and your weight down. Do you remember your weight?
Yes, it's 122.
122. Okay, I think that's what we had in the chart, but I'm going to double check. And quickly, I'd like to verify your height as well.
Okay.
If you can step forward in front of me. I have here this device that's going to let me measure your height very accurately. Alright. Okay, so I see you're about 65 inches. So that's 5 feet, 5 inches. Perfect. Okay, you can sit down now. Set this down and make a note of your weight and height. 5 feet, 5 inches. Excellent. Alright, Alessandra. Next up, I'm going to focus on your face. You can continue keeping your eyes closed and look forward for me. Okay. Just going to do just a skin inspection. Any soreness right here? Okay, no pain. Any pain right here?
No.
How about here? Any pain here?
No.
That's good. Not seeing anything out of the ordinary. No micro lesions, no redness. Okay. I'm going to take a couple of measurements. Can you please elevate your arms for me? Just like that. 78. And around this side. 78.1. Very good. Okay, you can lower your arms now. Can you tell me if you feel this equally on both sides of your face?
Yes.
And equally on both sides of your cheeks?
Yes.
And equally on both sides of your chin?
Yes.
Good. Right, I'm going to do a test that is called sharp or dull next. And if I can have your palm. This is dull and this is sharp. So continue keeping your eyes closed and tell me which one do you feel, sharp or dull?
Dull.
Good.
Sharp.
Good.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Rain sharp. Dull. 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 Sharp. Sharp. Dull. Dull.
Very good. Right, I have here a different device with a slightly different texture. I'm going to touch you all over your body with it. Can you please say yes when you feel it?
Yes. 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 Yes.
Okay. Next up, I have a slightly sharper device. Continue keeping your eyes closed and say yes when you feel it.
Yes. 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 Yes.
Good. I have here a device that is slightly sharper, and we're going to repeat the same test.
Yes. 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 Yes.
Very good. Okay. Now I have here acupressure device, and I'm going to touch over your body again. Try to localize it as best as you can and tell me where I'm touching you.
Forehead. Scalp.
Good.
Ear. No cheek. Chin.
Good.
Eyebrow. Middle of eyebrow. Collarbone. Collarbone. Left arm. Right arm. Right shoulder. left shoulder, right arm, right hand, right thigh, left thigh, left shoulder.
Just say yes when you feel an airflow coming towards you.
Yes. 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 Yes.
Okay. And where do you feel the airflow right now?
Scalp.
Good.
Right eye. Lips. Neck. Left thigh. Right thigh. Left hand. Right arm.
Good. Okay. Now I have here a device that is very cold, and then a device that is just a feather, so it's very soft. And I'm going to touch you with one of them. Tell me if it's cold or soft.
Cold.
Yes.
Soft. Cold. Soft. Cold. Soft. Soft. Cold. Soft. Cold. Soft. Cold. 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 Soft. Cold. So,
Good. Right. Next up, I'm going to put on my gloves and I'm going to check your head a little bit more thorough, as well as do a scalp check. So I'm going to begin by just feeling your head for symmetry and checking for any lumps or bumps, any tender areas that may have been caused by the fall you had on ice. Any tenderness when I press on your head?
no.
No, good. Not feeling any lumps or bumps. And head is symmetric. Right. Any pain when I press at the top of your spine?
No.
Good. And you mentioned that the tingling sensations happen in your back as well. Okay, I'm gonna do a back exam as well. Okay. Alright, no lumps, no bumps. I'm gonna feel your head from the back as well. Your right shoulder is a little bit more elevated than your left. Oh no, it's our palms. Any tingling sensations while I'm brushing your hair?
A little.
A little. That's interesting. That is expected though, as the scalp is a very sensitive area. Alright, next up I'm going to focus on inspecting your ears. Okay. Not seeing any abnormal discharges, no mold, no bumps. Normal oral cleft here. Any pain when I pull down? When I pull up?
No.
Good. And over on the other side, any pain when I pull down?
No.
How about when I pull up?
No.
Good. Okay. Inspect the outside of the teeth as well. No discharge. Alright, I'm going to do a quick hearing test. Tell me if you hear a sound getting closer to you or further away.
Closer. Further away.
Good.
Closer. Closer. Further away. Closer.
Good.
Further away. Closer. Further away. Closer.
Okay, I'm going to take a look inside your mouth next. Don't have my light. There we go. Can just open it. Okay, a little bit of an inflammation. Have you had any flu-like symptoms? Any flu-like symptoms in the last couple of days?
No.
Okay. Yeah, you have a little bit of a redness in the back of your throat, so I'm going to use these two swabs to take some samples of the inside of your mouth and see whether you have a bacterial infection. Okay, if you can please open one more. That's one cheek, and I'm gonna do the other one. Good. All right. I'm gonna send this to the lab. Right, next up I have here a medical hammer, and I'm going to gently tap on your whole body, check your reflexes, as well as do a little bit more of an in-depth neurological assessment. So let me know if you feel any pain, any soreness or tenderness. Okay, that's good. Okay, good. Alright, Sandra. Next up, I'd like to check your back. Okay. Okay, I'm going to listen to your lungs. Take a deep breath in and exhale. Good. Deep breath in and exhale. Deep breath in and exhale. Okay, you can just breathe normally now. Okay, good. Do you feel this?
Yes.
And this.
Yes.
And this.
Yes.
And this.
Yes. Yes.
Good. And this.
Yes.
Okay, I'm going to attempt to draw a letter. Try to identify it.
T.
Good.
O.
Mm-hmm.
L.
Mm-hmm.
C.
Very good.
X.
Okay. Just say yes when you feel me touching.
Yes. 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 Yes.
Okay. I'm going to go into something very, very soft. Just say yes when you feel the touch.
Yes. 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 Yes.
And do you feel this equally on both sides of your back?
Yes.
Equally on both sides.
Yes.
Equally on both sides.
Yes.
Good. You feel this?
Yes. 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 Yes.
Okay.
Yes.
Good. Okay. Your body has an even temperature distribution. Okay. Alright, Alessandra, you can get dressed now. Alright, Alessandra, next up I'm going to check your vision. I'm going to check for your pupil response to my light. So if you can look right here and keep your head straight and don't move it. Pupils are round and reactive to light. Normal response. Very good. Right, next up, I want you to look straight at me and tell me how many fingers you see me holding up. Try not to look at the fingers, just look at my face.
Okay. 1. 1.
All together?
Oh, sorry. 10.
Good.
2. 1. 2. 1. 2. 2.
Very good. So I'm not concerned with your vision. Your ears are perfectly fine. Your mouth is okay. Sensitivity of the skin seems to be perfect. So next up, I'd like you to please lay down. I'm going to check your tummy.
Okay.
Alright, Alessandra. I'm going to begin by listening to your tummy first, and I'm also going to check your lungs and your heart while you are in this position. So just breathe normally for me. Okay. Hearing a normal activity in all 4 quadrants. I'm going to check your heart. No murmurs. S1 and S2 is heard. No extra sound. Going to listen to your lungs next. No signs of bronchitis or pneumonia. Good. Alright, I'm going to do a light palpation next of your abdomen. Normal temperature. Is it okay if I lower your pants a little bit? Okay. So they're all back. Okay. Just checking for masses. Not feeling anything abnormal. Okay. Very good. You can come back up now. Alright, Alessandra, so I did a very thorough neurological examination of your whole body. I'm not able to find any red flags or anything. I'd stay away from the coconut for sure. And if the tingling sensations persist, come back and see me again.
Thank you so much.
Thank you as well. Do you have any questions for me?
No, I'm good. I really appreciate everything you've done.